sprains and strains. A couple of factors that contribute to these two things. So lack of conditioning, so starting to do some kind of exercise or activity when you're going too fast, too soon, and not progressing yourself up slowly, that can cause some of these issues. In addition to that, tired muscles. So if your muscles are just too fatigued, that means they're not prepped for the activity you're about to do. So that means you're going to end up doing an activity with muscles that are too tired to work. In that case, then you're easily able to strain a tendon or that muscle. Improper warm-ups. Most people don't do enough warm-up, so they don't do it either at all, or they're not doing it for the amount of time they should do it. Now, warm-ups are super important because they're there to increase blood flow and circulation to all those muscles and tendons in your body to prep you for the activity you're about to do. The other thing is poor equipment or footwear. So footwear, especially if you're using really old sneakers, really old cleats, and it doesn't have that stability that it needs to protect your ankles. Physical therapy can help you with that. Minor symptoms is, pain, swelling. Bruising is a big one, a lot with the strains. Like for instance, when someone strains their hamstring, it is quite common to see a lot of bruising on the back of the leg, into the knee even. Some decreased range of motion, so you're just having a little bit of hard time moving the joint. You're able to walk. It is uncomfortable, but you're still able to walk. Now, more major things when you have one of these injuries is that you have pain with even just a couple of steps of trying to put weight on. Unable to move the joint at all, like you have no active motion of that ankle joint, for instance. Pain and it's directly over a bone of the joint, that's not a good sign, because sometimes what happens is when you have a severe sprain of like your ankle ligament, the actual ligament being overstretched super fast in a short period of time can actually yank a piece of bone off and cause what's called an avulsion fracture. And the other thing is numbness. So if the swelling is persistent and you can't get that under control, and there's a lot of inflammation going along inside the joint, the actual swelling inside the joint can compress some of the nerves running through there and cause some numbness and tingling going on. If you don't address any of these things, continue to have pain, not have the ability to heal properly, so those tendons, ligaments, muscles will continue to cause a problem over and over again, which then may lead to complete tears of those items, whereas before it was probably some micro or small tears which actually can heal. But if you have a complete tear, that will actually lead to the need of surgery. Pain elsewhere, so a lot of people who have pain from an injury will also have pain other places because of compensation of other muscles in your body. So you're gonna end up having back pain even though you hurt your ankle or your knee. You might have some neck pain because you sprained your wrist. That's pretty common. The other thing is not even being able to walk without pain. If you can't put weight through your legs, you're not gonna be able to walk. And then that would lead to the inability to be able to play those sports or perform those recreational activities that you really enjoy doing. PT is super helpful with all these conditions. We can educate you about the condition with a thorough evaluation. The physical therapist is able to do special tests, check your range of motion and strength, and kind of assess how bad the situation is. Treatment is always based on the stage of the injury. So if it's an acute injury, we would base treatment off of that and help with decreasing inflammation, the swelling, help with pain, ice, manual techniques. For more chronic conditions, it's more about stability and strength, so we would be able to determine that. Exercise instruction, so giving you the proper exercises to give the different areas stability, making sure there is a lot of balance going on. A lot of time there's imbalance in a situation, especially with back injuries. Back injuries, your core, your stomach muscles, and your hip muscles are super weak. So your back muscles are compensating and taking over and they're being overused. So we would want to work on strengthening those opposing muscles of the core to help those back muscles kind of relax a little bit so that they're not overused. And then the other thing is injury prevention, to make sure that not only are we helping you through this injury, but making sure that you don't re-injure yourself again and giving you the proper tools that you would need in order to prevent that from happening. And then also with those people who are aiming to get back to sports or some kind of recreational activity, whether you're 10 years old all the way up to whether you're 80 years old, we would be able to guide you in the proper ways of getting back to the sport appropriately in a correct amount of time without, you figuring out when that would be appropriate and then re-injuring yourself again. If you would like some more information and to see how physical therapy can benefit you, please click the link below.